It is your finest sonographer, and today we are here to talk about our health again. Guess what? Today we are talking about the importance of ultrasound scan during pregnancy. Let's talk about what ultrasound scan is. Ultrasound scan is a safe imaging technique that uses sound waves to create pictures of babies in the womb, and then also it is a very essential part of antenatal care. Now, one may ask, why do I need to take an ultrasound scan when I'm pregnant? Well, let's look at some importance. One, it helps us to truly know whether a woman is pregnant. You know, sometimes you can miss your menses, but you are not pregnant. Yes. That is why you need to take an ultrasound scan. And then also, it helps us to detect the gestational age of your pregnancy, whether you are 1 month gone, 2 months gone, 3 months. And then also, it helps us to check the location of the pregnancy, whether it's a normal one or it's ectopic. And then we all know that ectopic is very, very, very dangerous. So if we get to know it is ectopic, we are able to intervene faster. And then also, it helps us to give you the accurate date of delivery, whether you are giving birth in a month, in 2 months, 3 months, thereof. And then also, it helps us to detect abnormalities or birth defects. Birth defects like club feet. You see some of the babies, you give birth to them and their toes are twisted. Yes, and then cleft lip. You see there's a space between the lip, very wide. Yeah, that is cleft lip. And then also hydrocephalus. Yes. Now, if you take ultrasound scan, we are able to detect all these things and then give you the advice you need during your pregnancy. And then also it helps us to determine the amniotic fluid around your baby. When I say amniotic fluid, there's some water around the baby. It helps us to detect whether it is too much or it is low or it is normal. And then also your placenta. It helps us to know whether it is high, low, or placenta previa. These are very dangerous things we have to take note of during our scans. You don't just go and lie down that the sonographer should just take a scan of the baby. You have to ask questions about all this. And then also it helps us to know whether your pregnancy is single, multiple, triplet, and so on. Whether you are giving birth to one, two, three, four, five, six. Yes.